You're gonna percuss the kidneys. You're gonna place the non-dominant hand. You're gonna put it in the costovertebral angle. That's where the ribs get together with the vertebral column. You put it right there, and with your dominant hand, you're gonna hit it very light. I mean, not too hard. So if you find like a tenderness at that point, it might be a sign of urinary infection. And you go to the other one. All right. That's the percussion of the kidneys. All right. Next, we move to the next step of the abdominal assessment, which is the palpation. So you palpate basically when you're looking for, through palpation you can determine the size of the organs. You can determine if there is any mass in the abdomen or there is any tenderness. So there are two. There are light palpation and deep palpation. So light palpation, you use your hand and you're gonna just press down like maybe 1 to 2 centimeters, and then you do like a circular movement. So you palpate 1 to 2 centimeters, lift, let go, palpate, and as you go palpation, you're observing the patient face, if there is any sign of pain. Also, before palpating, you always remember the area. If the patient has a painful area, you leave the area at the end. So you do light palpation of the whole abdomen. And then you can go ahead and do the deep palpation. Deep palpation, you're gonna use one hand. You can use it with one hand if the abdomen is not too big. But this time, you're gonna go deeper. You're gonna go like in a deeping movement, and you can go 4 to 6 centimeters. So it's gonna be like a deeping movement. Again, you're assessing for masses, the size of the organs, or any tenderness. So you do the whole quadrants. I didn't mention it, but we have the 4 quadrants. All right. And then you can go ahead and do the palpation of the organs. So we're gonna palpate the liver, the spleen, we can palpate the kidneys, and we also can palpate the bladder. So for the palpation of the liver, there are 2 ways. One way is that you can put your left hand, you're on the right side of the patient, you put the left hand right here by the costovertebral angle, like at the level of the 11 or 12 rib. And then your right hand, you're gonna put it right at the costal margin, right here. Then you ask the patient to inspirate, and as the patient inspirates, when he does the inspiration, the liver is gonna go down, and as he inspirates, you push upward, so the liver is touching the abdominal wall, and then you can determine the size or if there is any tenderness right there. So that's one way. Another way to palpate the liver is using your 2 hands. You're gonna put it right there by the rib cage, by the edge, the costal margin right here. You ask the patient, please take a deep breath, and as he inspirates, when he does the expiration, you dig in, and you can determine if if it crosses like the costal margin, you have an idea that the spleen is enlarged. You can determine if the patient has tenderness also. So those are the 2 ways to palpate the liver. Now, to palpate the spleen, you're gonna be on the right side of the patient, and you're gonna place your left hand under the costovertebral angle, and then you're gonna put the right hand right by the margin, the rib cage margin. And again, when ask the patient to breathe deep, and as he expirates, you push down and you try to palpate and determine the size of the spleen. All right. For the kidneys, for the left kidney, you're gonna use your right hand. You're gonna put it under the costovertebral angle, and you're gonna put your left hand at the edge of the rib cage. You ask the patient to breathe in, and as he expirates, you push this hand up and this one down, and you try to palpate it. It's kind of difficult to palpate kidneys, but that's how you do it. The right kidney, again, you're gonna put your hand